So, nursing. In the exam, you are going to have to give suggestions and advice. Okay, so in the OET speaking part of the exam, you know that you are a nurse. Wow. And as a nurse, you are going to have to talk to a patient or to a carer, someone who's taking care of the patient, the mother, father, I don't know, son, daughter, whatever. And one of the things you might have to do would be to give advice or suggestions. Now, in the exam, when you give suggestions, you need to create a context, you need to give details, and you need to check that the person can actually do those things. So let me give you an example. Let's say Mr. Smith had some blood tests, and the results are that he has a low level of iron. Mr. Smith is coming to you to discuss changes in his diet, okay, in order to improve his iron level, increase his iron level. Just a second, if we have anyone who doesn't know, I've just sent a message in the chat. So, when Mr. Smith comes to me, I first tell him about this problem. Look, Mr. Smith, you know, your iron level is quite low and there are some things you have to do. Usually the patient wants to go with a treatment, with medication, but in this case, medication might not be a long-term solution. It might be a short-term solution because there are some side effects. So in this case, I need to suggest some dietary changes, dietary modifications. So I'm going to suggest some things. Now, Mr. Smith might want or not to do those things. So I have to, in order to be able to give the best suggestions, I need to find out a bit more about the patient. And in order to do this, I'm going to create a context, give some details, explain a bit, and also check that the patient is able to do that thing. So I could say, Mr. Smith, do you drink coffee? Yes, nurse. I do drink about 4 or 5 cups of coffee a day. Well, Mr. Smith, you know, coffee actually inhibits iron absorption. Coffee actually inhibits iron absorption. And what you should do would be to try and reduce your coffee intake. What do you think about that? So I created a bit of a context. I gave some details, and I also checked. What do you think about that? Now, Mr. Smith is going to say, well, nurse, you know, I actually can't do that. Like, coffee helps me deal with stress at work, so I really can't drink less coffee. So then I can say, okay, Mr. Smith, how about drinking some orange juice? You know, orange juice helps with iron absorption. So even if you drink a bit more coffee, if you increase your iron intake, for example, from orange juice, this is going to help you. Would you be able to do that? This is my checking. Okay, I've just checked with the patient. Would you be able to do that? Yes, nurse, I think I can do that. Now, when we give suggestions, we are going to put them into 2 or maximum 3 categories and no more, okay? So because in the exam, in the speaking part of the exam, not in the writing part of the exam, you also need staging words. On the one hand, blah, 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 blah. On the other hand, blah, 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 blah. Or first, blah, 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 blah. Then, blah, 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 blah. Finally, blah, 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 blah. So if you have many things to suggest, my advice is to try and group them into maximum 3 categories. And because for each of them, for each category, you're going to have to create a bit of context and give some details and also check with the patient. So you could say, first, Mr. Smith, I'd like to ask you if you drink coffee. Yes, I drink 4 or 5 cups of coffee. We have the whole discussion. Mr. Smith says that he doesn't want to decrease his coffee consumption. And then I say, okay, Mr. Smith, then how about drinking a bit more orange juice? I give some context, some details. I check, are you willing to do that? Yes, I'm going to do that. Finally, Mr. Smith, it is important to have breakfast. Do you have breakfast in the morning, Mr. Smith? Oh, nurse, I don't really have breakfast in the morning. Well, Mr. Smith, especially because you are going to drink a bit more coffee than usual, it is advisable to have breakfast and to include iron fortified cereals because they are also going to help you long term. What do you think about that? Would you be willing to do that? Would you try that out? And whatever. So you need to check again. So suggestions is as a category is really important for us in the speaking part of the exam, giving suggestions and giving advice. When you do this in the exam, you need to have a conversation with the patient, find out things, create a context, give some details, and check each suggestion, then move on. Have a nice structure first, then finally. Or if you only have 2 suggestions on the one hand, on the other hand, because this is, at the end of the day, a language exam. Now, we do this creating context and details also because this is a dialogue. So in the speaking part of the exam, it's not just you showing off your English or your medical knowledge. You need to interact with the patient. You need to talk to the patient. So how do we give suggestions or advice? We use should or shouldn't. You should eat more fruit and vegetables. You shouldn't eat fatty foods. You could use tentative suggestions. How about, you see, these are not very powerful. They don't seem to be like strong, like it is advisable, it is important to, it is beneficial, it is essential. These are lighter versions, okay? How about drinking? Can I suggest you blah, 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 blah? So what we are going to do now is look at these sentences, exercise 6. And in each sentence, you have should or shouldn't, which you should replace with one of the other structures